Morning everyone, my name is Adrian Kakinda, a professional counselor and the PLO of Uganda Counseling Association, the premier body in our country that regulates counseling training and practice in our country. Now I bring you regards from the entire board of Uganda Counseling Association and the entire counseling fraternity. We are celebrating the World Mental Health Day today, 10th of October 2020. Actually, we celebrate this day every year since 1992, which has been a great initiative of the World Federation for Mental Health ever since. Now, this year's theme is very clear: move for mental health, increase the investment in mental health. You remember last year's theme was simply the mental health promotion and suicidal prevention due to the frequent cases of suicidal here and there. But of course, today we are now focusing on increased investment in mental health, and now we are joining the entire world to celebrate the World Mental Health Day. Why do we always commemorate such a day? Simply, we need to raise awareness of mental health issues and mobilizing efforts in support of mental health. Now, this year comes at a time when our daily lives have changed considerably as a result of COVID-19 pandemic. The past month have brought many challenges, including mental health challenges. Now, for example, you look at the healthy care service providers who have been providing care in difficult circumstances, going to work fearful of bringing COVID-19 to their home members. It has been a very, very big struggle to them, creating a lot of mental challenges, including stress, anxiety, and perhaps depression. Look at the students' body at large. The students went home on 18th March 2020 thinking that the COVID-19 pandemic was on a short notice. Actually, they thought they are going to come back to school after a short period of time, but guess what? It is taking months. It has created a lot of anxiety, adopting to taking classes from home, little contact with their teachers. Some are wondering, is it going to be a dead year? How are they going to complete their various courses at various levels? This has also created various mental health challenges to the extent of culminating into self-destructive behaviors like engaging in early sexual activities, engaging in healthy risk-taking behaviors like drugs addiction. Some children have become pregnant, etc. So mental challenges are very, very many in our students today. Look at the workers' livelihoods, whereby the livelihoods are threatened for the vast number of people caught in poverty or in fragile humanitarian settings with extremely limited protection from COVID-19 pandemic. This has also stricken the mental health capacity of our people today. And actually, for those people who have been having mild or extreme mental health conditions, now today many are experiencing even greater social isolation than before. Actually, various causes of mental health challenges, the economic consequences of the pandemic are already being felt, actually, as many companies let off staff as an effort to save their businesses, or indeed shut down completely. Some companies had to shut down completely. Given the past experience of emergencies, just like how COVID is, it is expected that the need for mental health and psychosocial support will substantially increase in coming months or years. Therefore, we need to step up the investment in mental health programs at the national and international levels, which has already suffered from years of chronic underfunding, is now more important than it has ever been before. We need to increase investment in mental health so that we can advocate. Before I leave the stage here, we also need to end the stigma around mental illness. This is not a job of Adrian alone. It's not a job for only mental health practitioners alone, but it's a job of every Ugandan watching me right now. You need to talk about it. You need to listen carefully and try to understand these people whom we presumably think they are undergoing mental health challenges. Choose your words carefully. Take actions to spread awareness, just like I'm doing so right now. Be an advocate for the positive change. Educate yourself. Educate yourself on mental health issues. And above all, offer support to the ones who are struggling. Today, World Health Organization has just given us a statistic. 1 billion people in the world over are suffering from mental health issues. Even you who is watching me right now, you may be undergoing hardships here and there. Bit of poverty, relationship breakups. People are going through a lot. People are quiet. People are undergoing through a lot of tantrums in their lives, and this makes them susceptible to mental health challenges. It can be a psychotic disorder, it can be a mood disorder, it can be stress, it can be anxiety, it can be trauma, it can be anything. Do you know where to go? Counselors are available, psychiatrists are available, but we're still grappling with the issue of limited investment in mental health in our country. This year, we are begging the stakeholders, governments on national levels. We are actually requesting various people who have the capacity to step up, increase investment in mental health practitioners training and practice in our country. My name is Adrian Kakinda, Ivan, a professional counselor, an advocate for mental health in this country, and the PLO of Uganda Counseling Association. I wish you a happy Mental Health Day 2020, and I think our government, you the people, will have to change attitude towards mental health delivery in this country. Bye for now.